You see, the human body is incredibly resilient. It can take years of abuse and still function. But eventually, the consequences of what we consume begin to reveal themselves, often silently. Today, I want to talk to you about something that sounds innocent. Something that might even be on your dinner plate tonight. A vegetable. One that many people consume daily, thinking they're doing the right thing. But this specific vegetable, in the wrong context, may be silently contributing to one of the most dangerous and preventable health issues of our time, blood clots. Most people grow up being told to eat their vegetables. Leafy greens, in particular, are championed as the pinnacle of health, packed with fiber, antioxidants, vitamins, and minerals. And that's largely true. These foods can have tremendous health benefits. But here's the nuance: what's healthy in general isn't always healthy for everyone. Kale, spinach, collard greens. These are all rich in vitamin K1, a fat-soluble vitamin essential for blood clotting. For the average person with no underlying health conditions, this nutrient poses no issue. But for someone taking anticoagulant medications like warfarin, or for individuals with certain genetic predispositions to clotting, these same vegetables can quietly become a health risk. The problem is not the vegetable itself, but its interaction with the individual's internal physiology and medical treatment. There's a fundamental principle here that often gets overlooked in nutrition conversations: context matters. While one person might thrive on a diet rich in leafy greens, another might see their blood become dangerously prone to clotting. Vitamin K1 activates clotting factors in the liver. That's its job. But if you're already prone to thrombosis, or you're taking a blood thinner to reduce clotting, then increasing your intake of vitamin K1 without adjusting your medication can throw off your coagulation balance, often without any symptoms until a clot forms. That's what makes it so dangerous. It's silent, it's hidden, and it's preventable. This is where the importance of personalization in health becomes so clear. Generalized dietary advice, eat more greens, drink more smoothies, take more supplements, may not apply universally. There are real biochemical consequences to what we put in our bodies, especially for those with underlying conditions. If someone starts a new health routine that includes a big daily dose of spinach or kale, thinking they're helping themselves, but they're on anticoagulants, they could unknowingly be reducing the effectiveness of that medication. The clotting system, which is already being managed carefully with medication, is now receiving mixed messages, and that could mean the difference between stability and a life-threatening event. This doesn't mean the answer is to demonize vegetables. It means understanding them. It means working with your doctor, checking your INR levels if you're on warfarin, and making sure your diet remains consistent, not erratic. It means realizing that nutrition is a form of information, biochemical instructions sent to your body with every bite. The question is whether those instructions align with your body's needs and current treatments. The broader message here is that we have to stop seeing nutrition as universally good or bad and start seeing it through the lens of our personal biology. The food that heals one person could harm another. Awareness is the first step. Once we understand that, we move away from fear and toward empowerment. The power to make choices that truly support our health based on who we are and what we need. Blood clots often go unnoticed until they cause something catastrophic. That's part of what makes them so dangerous. They operate silently, without obvious symptoms, until they strike in the form of a heart attack, a stroke, or a pulmonary embolism. These are not small health issues. They are life-altering, often life-threatening events that can happen to otherwise healthy individuals with little warning. And sometimes, the risk is building up not because of what you're doing wrong, but because of something you're doing right without knowing the potential consequences. Something as simple and routine as a daily salad rich in leafy greens can tip the scales in the wrong direction for people predisposed to clotting issues or those on anticoagulant therapy. The clotting process is essential to survival. When we cut ourselves or suffer trauma, the body's ability to stop bleeding through clot formation is nothing short of miraculous. But that same mechanism, when activated inappropriately or excessively, becomes harmful. And this is where the danger lies. Blood clots that form inside arteries or veins without injury are pathological. They can travel through the bloodstream, lodge in critical vessels, and cut off oxygen supply to the brain, heart, or lungs within minutes. The consequences can be fatal or leave permanent damage. This risk becomes more concerning when people unknowingly consume foods that accelerate clot formation. It's not about the occasional serving of spinach or kale, it's about routine, cumulative exposure. For individuals taking blood thinners, like warfarin, consistency in vitamin K intake is vital. A sudden spike in consumption of vitamin K1-rich foods can reduce the medication's effectiveness, allowing the blood to clot more easily. And that's where seemingly healthy habits can become hidden threats. A person may begin drinking green smoothies every morning, loaded with kale and spinach, thinking they're protecting their heart, when in fact, they may be setting the stage for a dangerous clot if their medication isn't adjusted accordingly. This silent nature of clot formation makes it crucial to understand and monitor what we put into our bodies. The average person does not think about clotting until something goes wrong, but that's too late. Prevention must be proactive. And part of that prevention is understanding how even beneficial foods can have unintended consequences in certain health contexts. Blood clots don't announce themselves with loud symptoms. A leg pain, a little swelling, shortness of breath, easily dismissed signs that, if ignored, can turn into full-blown emergencies. Recognizing the silent danger of blood clots requires a shift in perspective. Health is not just about doing healthy things, but about doing the right things for your specific body. That involves looking at nutrition not just as a way to boost energy or lose weight, but as a powerful force that interacts directly with your physiology for better or worse. Knowing how food influences the body's clotting system is part of being truly informed, and it could save your life. For many patients, the connection between medication and nutrition is never fully explained. They're given a prescription and a list of do's and don'ts, but rarely is there an in-depth discussion about how food can directly alter the effectiveness of their treatment. And yet, for individuals taking anticoagulants like warfarin, this connection is not just important, it's critical. What they eat doesn't just support their overall health, it actually determines how well their medication works. This is especially true when it comes to vitamin K1, the nutrient heavily concentrated in many green, leafy vegetables. Warfarin is designed to reduce the body's ability to form clots by limiting the action of vitamin K, which the liver uses to create clotting factors. But this system can be thrown off if a person suddenly starts consuming large amounts of vitamin K-rich foods without adjusting their medication. The body doesn't see a plate of spinach or kale as just a healthy meal. It sees a surge in vitamin K1, which the liver immediately uses to produce more clotting factors. The medication now has to work harder to maintain its effect, and in many cases, it simply can't keep up. The result: the blood becomes more prone to clot, increasing the risk of serious events like stroke, deep vein thrombosis, or pulmonary embolism. What's often misunderstood is that this is not about eliminating vegetables. It's about maintaining stability. Consistency in vitamin K intake allows clinicians to accurately dose medications like warfarin. But if patients are constantly fluctuating between days of high and low vitamin K consumption, it becomes incredibly difficult to find the right dose. One week, the blood might be too thin, putting the patient at risk for bleeding. The next week, it may be too thick, increasing the risk for clots. That kind of roller coaster can be dangerous and entirely avoidable with proper education and awareness. This is where healthcare has room for improvement. Patients deserve to know that food is not just fuel, it's a biochemical signal. And when you're on medication that interacts directly with those signals, your diet becomes part of your treatment plan. You wouldn't adjust your dose of medication without speaking to your doctor, but many people dramatically change their diet without realizing it has the same impact. There's a broader lesson here: healing doesn't happen in isolated compartments. Medication doesn't work in a vacuum. It works in the context of everything else the body is doing, including how it processes the food we eat. A truly effective treatment plan includes not only the prescription, but also a deep understanding of how that medication interacts with nutrition, lifestyle, and biology. Patients empowered with that knowledge can avoid dangerous interactions, maintain better control over their condition, and take an active role in their recovery. It's not just about taking a pill. It's about aligning the entire system for optimal health. Vitamin K1 plays a central role in the complex and finely tuned process of blood clotting. It acts as a crucial cofactor for the liver to produce several proteins known as clotting factors, specifically factors SU, V, X, and X, along with proteins C and S. Without sufficient vitamin K1, these proteins can't function properly, which can lead to excessive bleeding. On the flip side, too much vitamin K1, particularly in individuals with certain medical conditions or those taking anticoagulant medications, can promote inappropriate clot formation. This biochemical balance is delicate, and disruptions to it can have serious implications. The issue becomes especially important in individuals taking blood-thinning medications like warfarin. Warfarin works by inhibiting the recycling of vitamin K in the liver. By doing so, it reduces the liver's ability to produce active clotting factors, effectively thinning the blood. However, if a person increases their intake of vitamin K1, primarily found in dark leafy greens like spinach, kale, collard greens, and broccoli, it can override the effects of warfarin. The result is that the medication becomes less effective and the blood becomes more prone to clotting again. What makes this scenario particularly dangerous is that it often happens quietly, without any immediate symptoms. Many people are unaware that food and medication interact at such a deep biochemical level. They think of food as nourishment and medication as treatment, but the body doesn't distinguish between them in such a simple way. Instead, it receives constant signals from everything we consume. The liver, in particular, is like a biochemical control center. It's monitoring, processing, and responding to the nutrient and chemical inputs it receives all day long. When those inputs suddenly change, like a spike in vitamin K1, it adapts. And in doing so, it can alter the effectiveness of therapies that are meant to prevent something as serious as a stroke or a heart attack. This is why consistency is so important for individuals on anticoagulants. It's not that these vitamin K-rich vegetables need to be eliminated. Rather, the intake must be steady and predictable. Fluctuations are what disrupt the balance. For someone not on these medications, the body has regulatory mechanisms to handle variations in vitamin K intake. But for someone whose blood clotting capacity is being managed pharmaceutically, the margin for error is much smaller. Understanding the impact of vitamin K1 is not about instilling fear, but about appreciating the body's complexity. Each nutrient we ingest doesn't act in isolation. It's part of a broader system of interactions. Recognizing this and adjusting our habits accordingly empowers us to make smarter, safer choices. Food can either support our medical treatments or undermine them. By paying attention to these details, by aligning our diet with our treatment plan, we can avoid preventable complications and maintain the balance our body needs to stay healthy. The idea that one diet fits all is a persistent myth that continues to influence the way people eat, treat disease, and even prevent it. But the truth is that health doesn't work that way. Our bodies are not carbon copies of each other. They are incredibly unique, shaped by genetics, medical history, lifestyle, environment, and even the microbiome in the gut. This individuality means that what may be beneficial for one person could be harmful for another, especially when it comes to nutrients that have pharmacological effects like vitamin K1. The importance of personalized nutrition becomes impossible to ignore. Take the example of someone trying to improve their cardiovascular health. They start drinking green smoothies daily, loading them with spinach and kale because they've been told those are heart healthy, and in general they are. These vegetables support blood vessel function, provide antioxidants, and offer a host of micronutrients. But if that person is on warfarin, a blood thinner, that healthy smoothie becomes a disruptor. It increases vitamin K1 intake significantly, which directly counteracts the medication's intended effect. Now, the patient is at higher risk of developing a blood clot, not because they were neglecting their health, but because they were acting on generalized advice without understanding how it applies to their own body. This is why personalized nutrition matters. It's not about making eating complicated. It's about making it accurate. When people understand how their diet interacts with their specific medical conditions or medications, they can start making decisions that actually serve their health rather than unknowingly working against it. The challenge is that most dietary guidelines are built on population-wide recommendations. They're useful for general education, but they don't account for the individual variability that medicine increasingly recognizes as essential. Genetic differences, for example, can influence how a person metabolizes nutrients, how efficiently they recycle vitamin K, or how sensitive they are to warfarin. Two people can eat the same diet and experience completely different outcomes. Add in factors like age, weight, kidney function, and gut health, and the need for a more personalized approach becomes clear. It's no longer enough to say, eat more greens. We need to be asking, which greens, how much, and for whom. The future of healthcare is moving in the direction of precision medicine, precision diagnostics, and yes, precision nutrition. Instead of broad recommendations, we now have the tools to tailor plans that reflect the unique biochemical makeup of each person. But even before the science becomes fully personalized, the mindset needs to shift. We need to start looking at food not just as fuel, but as a therapeutic tool, one that interacts with medications, influences physiology, and changes outcomes. The goal is not restriction. It's alignment. It's making sure that what you eat supports, not sabotages, your body's current needs and treatments. And it starts with recognizing that the healthiest diet is the one that fits you. The most powerful determinant of long-term health isn't found in a pill or a procedure. It's found in daily choices. And those choices are driven by awareness and responsibility. Many of the chronic health issues people face today don't stem from a lack of access to information, but from not realizing how critical their role is in their own health journey. Nutrition, lifestyle, medication adherence, and preventive care all work together, but only when the individual takes an active role in understanding and applying them. Blood clots, for example, often seem like random, sudden medical emergencies, but in many cases, they're the product of cumulative risks that build over time, some of which are modifiable. Diet is one of the most controllable risk factors, but it requires the individual to recognize how specific foods affect their physiology, especially when medications are involved. A person on blood thinners who consumes vitamin K-rich vegetables inconsistently may not notice any symptoms for weeks or months. But inside their body, the clotting balance is shifting. The medication's effectiveness is fluctuating. And eventually, that instability may result in a clot that could have been prevented. This is why personal responsibility is not a burden. It's a form of empowerment. When individuals become aware of how their choices impact their biology, they gain the ability to intervene early, course correct, and prevent disease instead of merely reacting to it. But that can only happen when people stop seeing healthcare as something that's done to them and start seeing it as something they are part of. Doctors provide guidance, medications offer support, but it's the daily habits, sleep, hydration, movement, food, that determine whether the foundation of health is being built or broken down. Part of responsibility is consistency. The body thrives on predictability, especially when medications like warfarin are involved. Large fluctuations in vitamin K intake, one day eating a salad packed with spinach, the next avoiding greens altogether, create instability in how the drug works. But when patients are consistent and communicate with their healthcare providers, doses can be adjusted and the therapeutic window maintained safely. That's the power of awareness. It turns passive treatment into active partnership. It's also about being willing to ask questions. What's in this smoothie? How will this supplement affect my medication? Is my lifestyle aligned with my condition? That kind of curiosity and vigilance isn't overcautious. It's wise. And it prevents complications down the line. When people understand that food is more than just calories, that it's information, medicine, and signal, they begin to engage with it differently. Every bite becomes a choice not just for energy, but for healing or harm. Ultimately, no one is more invested in your health than you are. No doctor, no medication, no treatment plan can replace the power of an informed individual making intentional choices. And that begins with awareness. Seeing the silent, long-term effects of everyday decisions and the responsibility to act on that knowledge. That's not fear-based living. That's proactive, empowered, and deeply effective health stewardship.